Breast cancer treatment options and early detection has really helped increase our number of breast cancer survivors. So what next? Salina Regional Health Center brings you a Breast Cancer Survivorship Program. I'm Alison Hiatt, Advanced Practice Registered Nurse at Tammy Walker Cancer Center.
Well, Allison, thank you so much for being on the show. We're going to be talking about cancer survivorship, in particular breast cancer survivorship, through the lens of a survivorship clinic you have going on. Why don't you tell us about that?
Yeah, thanks, and thanks for having me on, Mike. So cancer survivorship has really become a newer trend in oncology services nationwide. Fortunately, treatment options are improving, and as a result, patients are just having better outcomes and a lot of times living longer. So it's our job to make sure we're helping to optimize their quality of life and their overall health moving forward beyond that diagnosis state. And so that's the purpose of the survivorship program.
What are some of the areas you work at with the patients?
So when they come in for those visits, I give them a manual as well as a personalized care plan that's really going to tailor to their individual needs. We're going to talk about some lingering side effects they might be experiencing, whether it's from treatment or the cancer diagnosis itself. I also take the time to make sure they've had genetic testing completed. That's a really important component because they may carry a gene that makes them more prone to a secondary cancer, or they may have a family member who's more likely to develop a cancer, and so we want to make sure that they're being monitored well. And we also talk about psychosocial concerns that could be lingering. This can be a really stressful time for patients and their families, and we want to make sure we're taking care of them mentally and emotionally as well as physically. And then the final component is, are there any positive lifestyle changes we should be making? Do they need to establish an exercise routine, or we need to make some diet adjustments? So we'll form an action plan for those things, and they'll go away with that plan, and then I'll follow up with them anywhere from 1 to 3 times a year to make sure we're moving in the right direction.
I know no two cancers are alike, and probably no two recoveries and survivorship is alike, but why don't you take us through a typical scenario of what the patients will do?
So just breast cancer alone, there's a variety of types of breast cancer. So some might be what we call estrogen receptor positive. That means that the breast cancer is actually going to feed off of estrogen. So those patients need placed on a hormone blocker for 5 to 10 years. And that can cause sometimes some side effects like debilitating joint pain or hot flashes or sexual concerns or mood changes. Well, that patient's going to have different needs from somebody who maybe doesn't need that therapy but has really aggressive chemotherapy. And they might have problems such as chronic fatigue or some brain fog that's just hard to shake. And so we just really need to tailor to each individual.
And I know you're starting out with breast cancer, but I think your goal is to kind of take this further, right?
Absolutely, yes. So we started with breast cancer because that is our highest volume, so the demand there is the highest, but all of our cancer patients are important to us, and we definitely plan to be inclusive to all of our survivors eventually.
And thank you for watching. For more information, you may visit TammyWalkerCancerCenter.com and like them on Facebook.